Hey everyone, welcome back to the Wellness Coach. If you're new here, this channel is all about helping you through your pre-pregnancy journey with real talk, real support, and everything you need to know about fertility, hormones, and preparing for pregnancy. Today's video is about a condition that affects millions of women, and yet it's still often misunderstood and misdiagnosed. We're talking about endometriosis and how it impacts fertility. More importantly, we're answering the question that so many women ask: is pregnancy still possible if I have endometriosis? Let's dive in. So first, what is endometriosis? Endometriosis is a chronic condition where tissue similar to the lining of the uterus, the endometrium, starts growing outside the uterus. This tissue can grow on the ovaries, fallopian tubes, the outer surface of the uterus, and even in other parts of the body. Now, because this tissue behaves like the uterine lining, it thickens and bleeds with each menstrual cycle. But unlike your period, this blood has nowhere to go. This causes inflammation, scarring, cysts, and often severe pain. Some of the most common symptoms of endometriosis include painful periods, also known as dysmenorrhea, pain during or after sex, pain with bowel movements or urination, especially during menstruation, chronic pelvic pain, heavy menstrual bleeding, fatigue, difficulty getting pregnant. It's important to note that not everyone with endometriosis has symptoms. Some women don't know they have it until they start trying to conceive and run into trouble. So how does endometriosis affect fertility? First, it can distort the reproductive anatomy. Adhesions and scar tissue from inflammation can block the fallopian tubes or interfere with the release of eggs from the ovaries. Second, endometriosis can create a hostile environment in the pelvis, with inflammatory chemicals and immune responses that may reduce egg quality or interfere with fertilization and implantation. Third, it can also affect hormone levels, especially if endometriomas, cysts caused by endometriosis, are present on the ovaries. That said, and this is important, not everyone with endometriosis is infertile. In fact, many women with mild to moderate endometriosis conceive naturally. And even those with more severe forms still have options. So the big question, is pregnancy still possible with endometriosis? Yes, but it might take more time, planning, and in some cases, medical support. Let's talk about your options. First, get a diagnosis. If you suspect endometriosis, see a gynecologist or reproductive endocrinologist. Diagnosis is usually based on symptoms, imaging like ultrasound or MRI, and sometimes confirmed through a procedure called laparoscopy, where a small camera is inserted into the abdomen to look for and remove lesions. Once diagnosed, your doctor will help determine the severity of the condition, often using a system with 4 stages, from minimal to severe. But remember, the stage doesn't always predict fertility outcomes. Some women with stage 1 have trouble conceiving, while others with stage 4 get pregnant naturally. If you're trying to conceive with endometriosis, here are some paths your doctor may recommend. 1. Try naturally for a certain period, especially if you're under 35 and your partner has no fertility issues. You might be advised to track ovulation closely and time intercourse accordingly. 2. Consider fertility treatments. Ovulation induction with medications like Clomid or letrozole. Intrauterine insemination, IUI, to give sperm a head start. In vitro fertilization, IVF, especially if there are blocked tubes or ovarian involvement. IVF is often considered the most effective treatment for endometriosis-related infertility, particularly for moderate to severe cases. Success rates vary by age, but many women with endometriosis do go on to have successful pregnancies through IVF. Third surgery to remove endometrial lesions may be recommended if pain is severe or if imaging shows endometriomas. In some cases, this can improve fertility, but it's not always necessary or the first step. 4. Complementary approaches. Many women also explore acupuncture, anti-inflammatory diets, and lifestyle changes to help manage symptoms and support overall reproductive health. Now, let's talk about a few lifestyle tips to support your fertility with endometriosis. Focus on an anti-inflammatory diet. Include plenty of fruits, vegetables, omega-3 rich foods, and avoid processed, high-sugar items. Maintain a healthy weight. Excess body fat can affect estrogen levels and worsen endo symptoms. Stay active, but don't overdo it. Gentle movement like yoga or walking can help ease pain and improve blood flow. Reduce stress, easier said than done, but stress can impact hormones. Mindfulness, journaling, and breathing exercises can help. Avoid environmental toxins where possible. Switch to clean beauty and household products to lower your toxic load. Also, don't forget to include your partner in the conversation. Male factor infertility can also play a role, and supporting one another emotionally is crucial. Now, a quick word about pregnancy and endometriosis. Some women find that pregnancy actually eases their symptoms due to the hormonal changes during those 9 months. But this isn't always the case, and endo symptoms may return after giving birth. So what's the takeaway? Endometriosis can make getting pregnant more challenging, but it does not make it impossible. With the right plan, the right support, and the right mindset, many women with endometriosis go on to have healthy pregnancies and beautiful families. If you think you might have endometriosis or you've been diagnosed, don't lose hope. You are not alone. There are options, there are answers, and you deserve to be supported on this journey. If you found this video helpful, give it thumbs up and subscribe for more videos on fertility, hormones, and preparing for pregnancy. Thank you for watching, and I'll see you in the next one.